Now, let's introduce the docs. First, we have Dr. Iyantta Matthews, the Director of Diversity and Inclusion Office. Next, we have Dr. Leah Robinson, the Director of Academic Support, I like to say academic success, for the Office of Diversity and Inclusion. And lastly, we have Dr. Iyantta Howell, a psychiatrist for the Common Ground Resource and Crisis Center in Pontiac, Michigan. Thank you all so much for joining me today. It sounds like the best means to deal with grief is to acknowledge what's happening, ride the roller coaster of emotions with love, and cherish our memories. However, is there an exact science to grieving? Well, we have our guest psychiatrist, Dr. Howell, here, who can explore this with us. And Dr. Howell, what is grief?
Thank you for that question. It's a great question. I think grief can sometimes be a difficult concept to understand, but simply put, grief is just a response to a loss. And of course, a loss can take on many forms. I think what people think about when they think about grief is, someone has died. And obviously that's, a very devastating loss. Dr. Matthews shared how she had a number of losses just back to back to back. So Dr. Matthews, I do appreciate you sharing that very painful parts of your life with us. And there's probably people who are watching who can relate, who've lost people to COVID-19 or, or just any natural cause. People are still dying from things like heart attack, stroke. People are just still ill in the midst of a pandemic from other reasons. And, there's been a lot of loss. So these are some of the most common forms of loss. But again, loss can take on any form. For instance, I'm sure a lot of people are dealing in their own ways with the loss of the things that they had planned for 2020. There were so many people who, envisioned themselves walking across the stage, 4 years ago or 10 years ago or 12 years ago. And here it is, they can't really have that experience, those milestones. A person whose child would have been the first graduate from either high school or college. These are some very important losses in addition to, like we talked about last time, loss of income, loss of a job, so I think a lot of people can relate to that. And as you have here on the screen, not all grief involves death. So that was the point that I was making there. And grief is not always obvious. So it is possible for a person to be grieving and not know it. And that's a little bit what Dr. Robinson spoke about. So a tool that I like to use when I describe grief or what grief is the 5 stages of grief. So I hope you guys can see this clearly, but this is a well-known conceptualization of stages of grief that people go through. It describes 5 different emotions that were first described by a psychiatrist in 1969 by the name of Dr. Elizabeth Kubler-Ross. And you want to remember that name because she is considered a founding father or mother in the field of grief and loss. She's done a lot of work on grief and loss. And like I said, she identified 5 emotions that people often experience when they're grieving. So the first emotion, and these are not in any particular order, but the first emotion is denial. So that's basically when you hear the news, it just kind of shocks you and you're just in a state of disbelief. So that's the first stage. And then some people will leave that stage, go into the anger phase where you're just you're angry because the person is gone or the thing that you cherished is gone. And then the third stage is the bargaining or rationalization stage. And I like to think of a scenario that I often use as an example of, a father on his deathbed and the son is, trying to bargain with God and say, hey, I'll do XYZ for you, God, if you heal my father, and when in fact the death is more than likely inevitable, but the person really just does not want to let go. This also involves the what ifs that people ask themselves about, and the regrets that they may have about a person's death. So that's that stage. And then the next stage is depression or despair. And it's pretty much just that, you're hopeless, you feel like there's no way out, and you're just really low emotionally. And I want to make a distinction between this stage in grief and actual clinical depression. So that's different. So with clinical depression, you have a constellation of symptoms that lasts for about 2 or more weeks. And, it includes unexplained changes in sleep, energy level, appetite, concentration, and in some cases, it can include suicidal thinking. This is not that. So if you're grieving and you happen to have suicidal thoughts, that is not part of the normal grieving process. That's not what we're talking about here. So if you have, active thoughts of wanting to kill yourself, meaning you have an intent to kill yourself and you have a plan, or if you're having passive thoughts of suicide, meaning, you just kind of don't want to be around. You often fantasize about how it would be if you weren't around. You really need to be contacting a mental health provider and reaching out for support, okay? So the depression here in this grief cycle is not the depression that, will require treatment, okay? And then the last stage is acceptance. And that's when the person basically accepts the fact that, the loved one is gone, that death is final and it's irreversible. And, no matter what you do, the person or thing that you lost is not coming back. So that was Dr. Kubler-Ross's contribution to that particular discussion. And then recently, a gentleman by the name of David Kessler actually added a 6th stage of grief. And that stage was finding meaning. So this gentleman did some work alongside of Dr. Kubler-Ross prior to her death. And he is also known as an expert in the field of grief and loss, partly because of his work with her, but also because of his own experiences with grief and loss. As a child, he witnessed a mass shooting while at the same time was experiencing the death of his mother. And, when he became an adult, he lost his adult son. So he has a lot to say on the topic. So anyone dealing with grief or loss, this would be a great book to have. So I would highly recommend this one. So yeah, some stages to keep in mind as you're grieving, just to know that, no, you're not going crazy. Everyone goes through this stage. And, as was stated before, definitely reach out for help if you're struggling. So these are mental health resources. For those of you who are Wayne State students, if you feel the need to reach out to a counselor, a therapist, Wayne State does offer free and confidential counseling through their CAPS program. You can log on to caps.wayne.edu, or call 313-577-3398. The state of Michigan has, they basically launched a Stay Well initiative at the beginning of the COVID-19, and they are basically also offering free counseling to every person who lives in Michigan. So you can take advantage of that 24 hours a day, 7 days a week. You can log on to their website at michigan.gov/staywell, or you can call them at 1-888-535-6136, and you want to press option 8. But if you don't feel like talking, they've even created an option for you to text the keyword restore to 741-741. And if those options aren't appealing to you, you can always reach out to your primary care doctor and tell them that you would like to be referred to a mental health professional. So hopefully these are some helpful tips for you.
All right. Thank you so much for sharing those wonderful resources with us, Dr. Howell.